And on the line with us is Wendell Potter, our old friend, health insurance industry whistleblower, columnist with the Center for Public Integrity and with Huffington Post. He's the author of several books, his latest with Nick Penman, Nation on the Take, How Big Money Corrupts Our Democracy and What We Can Do About It. His previous books are Deadly Spin and Obamacare, What's in It for Me. His website, Wendell, with two L's, wendellpotter.com. And you can tweet him at Wendell Potter. Wendell Potter, welcome back to the program.
Thank you so much, Tom. Appreciate being back on the show.
Always great having you with us. The public option was discussed, and I believe the DNC's platform committee voted to endorse essentially a public option in Obamacare. Do I have that right?
You're correct, which is really big news. It's a new development. Just a couple of days ago, they decided to do that. So Hillary Clinton's campaign is embracing the public option. She's calling for it to be offered in all the states, as well as allowing those who are 55 or older to be able to enroll in Medicare early. So these are very big developments.
Yeah. What does this mean? If a public option was added to Obamacare, to the Affordable Care Act, what might it look like? How would it work? And what would it mean for the future of the way that we deliver health care in this country, or at least the way we pay for health care in this country? Well,
it could be very, very big. In fact, if you may recall, the original version of the Affordable Care Act, or Obamacare, included a public option, and the version that was actually passed by the House included it. It was stripped out of the Senate version at the last minute, and so it was not a part of the final bill, of course.
Yeah, wasn't that Joe Lieberman's efforts to strip that out?
Exactly. It was Joe Lieberman. The insurance industry did not want it. They pulled out all the stops to get it killed, and Joe turned out to be their go-to guy, Joe Lieberman, to get it stripped out. He was able to do it. So that's why we don't have it now. But if it were in there, and if we can have one going forward, if Hillary Clinton is elected president and she really champions this and pushes it forward, we would have the ability, we as in any American, would be able to buy a health insurance plan that was operated by the government. It could be somewhat comparable to the Medicare program for anyone of any age. It would operate largely like maybe kind of a blend between a Medicare and a private insurance company. It would, but it would be government run, and it would not need to spend money paying high salaries to executives or enormous sums of money on advertising and marketing and underwriting. So it could be an economic choice. So it would be a big, big deal. And as you can imagine, the insurance industry will fight it tooth and nail to try to keep it from happening. But it's very encouraging that she's behind this idea.
Well, the insurance industry, with regard to Medicare itself, which is our single-payer public option for people who are over 65, that has had so many holes drilled in it over the years. It only covers 80% of expenses. It's got the donut hole on drugs. It's got, this exemption and that exemption. And the insurance industry, I mean, one of the reasons why Stephen Hemsley has taken over $1 billion in compensation from United Healthcare is because they're the principal provider of these Medicare supplements policies through AARP. And they make a fortune for the industry. Do you think that if a public option is rolled out, that the Republicans will figure out a way to make the public option sufficiently incomplete, as is Medicare, that you're pretty much forced to buy something from the health insurance companies to keep, to keep the Republican, the masters of the Republicans happy?
Well, that would be what they would try to do as a last resort if they couldn't stop it from happening. There's no doubt about it. And you're right. The current Medicare program has deficiencies. It also doesn't cover dental care or vision care. And while the donut hole is gradually being closed, people have to pay a lot of money currently out of their own pockets for medications, and that's the fastest growing part of health care. So you're right. The Democrats would have to be on guard to try to keep that from happening. What the United has also done, as you undoubtedly know, not only are is United selling those Medicare supplement policies. They and a few other big insurers are selling the private alternatives to Medicare. They call them Medicare Advantage plans.
Right.
And United is the biggest operator of those plans. Humana is second. And about 30% of Americans are now enrolled in these plans, which is troubling to me. But this is something that the Republicans in Congress has passed, and certainly during the Bush administration were able to push forward. So
yeah, and let me make it very clear to people, to any of our listeners or viewers who may be about to turn 65 or in that neighborhood. Correct me if I'm wrong, Wendell, you're the expert on this, but my understanding is that once you sign up for a Medicare Advantage program, you have abandoned Medicare forever, and you are now left to the tender mercies of whichever health insurance company you have signed up with. Do I have that right?
Well, not forever, but you do sign up for a period of time, and it's usually for a year. Now, my parents have signed up for a Medicare Advantage plan, and as they got older, I realized they would be better off in traditional Medicare. Mm-hmm. So I was able to change it for my mother.
Oh, good.
My father passed away. So it's something you can do, but once you sign up, you're locked in for at least a year. And I can tell you that for people as they're getting older, these might not be, as I found out from my own mother, might certainly not be the best plan for you at all. In fact, you'd be much better off in traditional Medicare in many cases.
Yeah. Yeah. Well, I mean, it's a plan being offered by a for-profit health insurance company. They're going to do everything they can to screw you. That's the
exactly. Because their objective is to make money. Yeah. Not to take care of you, but to make money. That's why they're in business. And so circling back, Democrats would need to be on guard to make sure that this would be a true public option, one that's not taken over by the private insurance industry. So that would be that'd be something we'd have to watch. And
I mean, we're seeing this kind of deceptive. I mean, right now, for example, with GMO labeling. Vermont, July 1st, Vermont's law kicked in, and companies are required to label all products with GMOs being sold in Vermont. So now we've got not just Republicans, but 6 Democrats, and some of them, pretty decent people. Debbie Stabenow and Bob Casey and Amy Klobuchar, Claire McCaskill, Sherrod Brown, Al Franken, voting to preempt Vermont's laws. Say, sorry, we're going to set aside Vermont's law. We're going to give the USDA 2 years to study this thing, and then after that, companies can put a little black box, a QR code on your label. In other words, making it possible for people to figure out if there's GMO products in their food or not. And they're calling this a national labeling standard. So they'll figure out some way to call this a public option and have it not be if we let them, if we don't pay attention.
If we let them. You're so right. It can't be watered down and be meaningless. So people I will continue to keep an eye on this if it goes forward and champion it, because it is something that would be good for us to have as an option. Medicare beneficiaries have a private alternative. Why shouldn't we have a public alternative if we're not yet eligible for Medicare?
Right. Or for that matter, why don't we all just have a public option? And
that's right.
I mean, I'm still on single payer health care, but single payer did get voted down in the Democratic Platform Committee, right?
It did. It did, and I'm sure there'll be quite a bit of noise about that at the convention. I'm in Philadelphia, so we're 2 weeks away from that, and I know the single-payer folks are going to be making their displeasure known about that.
Yeah. Although, lacking that, a public option, if it turns out to be a real public option and not like this phony baloney GMO labeling thing, could be a very, very good thing. Wendell Potter, health insurance industry whistleblower, columnist for public integrity, WendellPotter.com. Thank you, Wendell.
Thanks so much. Take care now.
It's great having you with us. Thank you.
To watch more clips from our programs, hit the Watch More Videos button over here. And please be sure to hit the handy-dandy subscribe button so you'll always be up to date. Tag, you're it.